Good afternoon, everyone. This is a WSAV News 3 special report. We are on your side tonight with an update from South Carolina Governor Henry McMaster on the state's response to the coronavirus outbreak. The governor is at the podium now. Let's listen in.
Knowing that Team South Carolina is always ready, always there, ready to respond. Hear us, your servants, as we pray in your most holy name. Amen.
Amen. Thank you, sir. We appreciate you coming today. We have a number of people who will provide information, and we'll have questions when we get to the end and try to answer all your questions. Effective immediately, I've ordered the closing of all schools in the state of South Carolina, starting tomorrow, Monday, March 16th. That means no schools starting tomorrow. Schools will remain closed until the end of the month, that is March 31st. This includes pre-K through 12, all universities, colleges, and technical colleges. Additionally, I ask that and urge that public gatherings, both indoors and outdoors, be limited to 100 people or less. This does not include state or local government meetings or businesses or employers. Also, all local and municipal elections shall be postponed and rescheduled after May the 1st. Candidates, however, filing for state, local, and federal offices shall continue as currently scheduled. County elections offices shall continue to operate as normal. Yesterday, I requested that all utilities in South Carolina not suspend or disconnect any essential services for non-payment for the duration of the current state of emergency. I repeat that request today. I have granted state agency leaders the maximum flexibility to protect their older or at-risk employees by allowing them to work from home. Additionally, all non-essential work-related travel by state employees is now prohibited. And the Board of Medical Examiners and the Board of Nursing have procedures in place to issue temporary licenses for out-of-state physicians, physician's assistants, nurses, and respiratory care practitioners within 24 hours. And additionally, there is no fee for these licenses, which will last for 90 days, temporary licenses. I want to emphasize that there is no shortage of testing capabilities in the labs in South Carolina. The DHEC lab and the private labs currently have more than adequate supplies, more than adequate, to conduct all the tests we need. And the DHEC lab will be resupplied with more tests this week. In addition, the Federal Drug Administration has today approved the Medical University of South Carolina for COVID-19 testing. MUSC has said that they will likely start processing these tests in their lab by the end of this week. And as you already know, the MUSC.care is where you can go online to receive screening from anywhere in this state for free at this time. That was announced last week. We've heard a lot about masks and their scarcity. As the Surgeon General Jerome Adams has said, there is no need, I repeat, there is no need for the public to buy masks or wear masks. Our healthcare professionals are the ones who critically need to have these masks because they're the ones that are providing care and it will keep them safe. DHEC has requested that the federal government release South Carolina's allocation of medical supplies from the Strategic National Stockpile. Items such as respirators, masks, face shields, gloves, and gowns. But that allocation will not be everything our healthcare professionals may need for the duration of this coronavirus situation. The private manufacturers have cranked up production, as you have heard, but it'll take them a bit of time to get them out into the flow in the market. That is why it is important for the public who do not need these masks not to go out and buy them. All the decisions that we have made thus far have been to do one thing, and that's to save the lives of the people of South Carolina. School closings are inconvenient. We know that. They're inconvenient for everybody, for working parents, for families, as well as employers. We understand that. Parents, if you've not done so already, now is the time to explain to your children in an age-appropriate way how serious the coronavirus situation is. It is time for parents to impress upon their children how important things like social distancing, that is keeping your distance from someone coughing, sneezing, that sort of thing, personal hygiene, washing your hands all day long. Impress upon the children how important that is, and also that will help us remember ourselves. And we must also explain the importance of limiting exposure to those considered at risk, like the elderly or the infirm. I ask that our faith community in South Carolina, that is our churches, parishes, synagogues, periodically check in on your members, especially those who are considered at risk, the elderly and the infirm. Many of these older citizens live by themselves, have trouble getting around, have difficulty communicating, and this is an excellent thing for our faith community to undertake. I'll say finally, we are going to get through this, and we are going to get through this, as we've gotten through other things, by remaining calm, using common sense, being deliberate, treating everyone like a neighbor, and demonstrating courtesy and compassion towards each other. Courtesy and compassion means that we don't purchase more supplies that we need. There's no need to hoard food or supplies of any kind. I assure you the stores will remain open and they will be restocked and restocked and restocked. President Trump has declared today as a national day of prayer. We had the chaplain here a moment ago. I ask that every South Carolinian pray for the health and safety of our neighbors, of our families, and for our nation. Superintendent Spearman.
Thank you, Governor. Good afternoon, everyone. I first want to assure all the parents of school children in this state that we are still in a partnership, and principals, superintendents, teachers are working together as we speak to prepare to continue instruction for your children, and also to be sure that those who need to be fed will be fed. The South Carolina Department of Education Office of Health and Nutrition has been granted a waiver from the United States Department of Agriculture that allows our summer feeding options to be used during this school closure. We have also received a waiver for flexibility so that meals can be the grab and go type. We'll either have you come by and pick up the meals, or we'll be delivering those to you on our school buses. These waivers will allow communities to provide 2 nutritious meals to students who may not have access to them outside of the school day. Applications to begin that service are already being screened by our office and will be received promptly in the morning. Our transportation office is in talks with service providers to equip some 3,000 school buses that we have the hardware to deliver Wi-Fi. We're asking our service providers to work with us so that these buses could be used in remote areas so that folks could come to those buses throughout the day if they do not have Wi-Fi access. We're also encouraging districts to utilize our state fleet of about 6,000 buses to drop off instructional materials to students along bus routes if they're unable to come to school and for the pickup. Our state and federal accountability. We will seek authority from the General Assembly and the State Board of Education to waive any statutory requirement and regulation as they relate to emergency needs. I also want to announce, and I have the support of Governor McMaster, that I will be seeking a waiver from the United States Department of Education to suspend federally required student assessments that are traditionally administered during the spring. There's no need for our teachers and our students to have this anxiety of what's going to happen on testing, so we are going to ask to suspend those tests this year. We've asked school districts to submit 10-day instructional plans to our agency for review. Schools will be asked to implement these plans during closures. Additionally, I have been in discussion with Anthony Paget, the president of SCETV. His staff and our folks are working together to reschedule the ETV programming that is delivered on their regular TV station. As you know, those have different channels that children view inside their school, but those channels are not available at home. So we will be making an announcement tomorrow about how that scheduling will be, and any child can access that on their own TV at home. We are also working to supplement instructional availability. The State Department runs Virtual SC. This is already a program that some 34,000 students across our state access for free each day, whether they're public school, private school, or homeschool students. We will be posting additional information and seeking additional licensures so that more students can take advantage of this wonderful opportunity. We're working hard together. I want to thank again all of the school administrators, teachers who have been working to prepare for this moment, and we believe that we have made the decision at the right time. Thank you, sir.
Thank you. Dr. Linda Bell, Department of Health and Environmental Control.
Good afternoon. As an update, DHEC is investigating 9 new possible cases of COVID-19 novel coronavirus, including 3 from Kershaw County, 3 from Horry County, 2 from Anderson County, and 1 from Greenville County. One of the cases from Kershaw County was an employee of a child care facility. The person was not ill while they were at work. We have notified the facility. However, we do not consider the staff and children of the child care facility at risk from exposure in that center. The center is also following the governor's closure of schools in Kershaw and Lancaster County and is currently not open. In addition, we announced 6 new cases yesterday, including 1 new case from Lexington County, who was a resident of the Lexington Medical Center Extended Care Skilled Nursing Facility. The individual is currently hospitalized and is isolated and has no known exposures to another case and no recent history of travel to an impacted area. We are working with the facility to identify close contacts and are providing guidance about infection control measures to prevent possible spread. To date, DHEC's Public Health Laboratory has conducted 263 tests, 28 positive and 235 are negative. While we are not currently seeing widespread transmission in South Carolina, we want people to be prepared and to remain calm and rational as more cases occur. Recognize that the majority of illnesses seen are relatively mild, the type of illness for which you might not normally even seek medical care. Testing individuals without symptoms is not recommended. We do not recommend that everyone who is ill get a test to see if they have the COVID-19 infection. If disease activity increases significantly, we will advise people to stay home, get better, and seek medical care if symptoms worsen. This will allow our healthcare system and our healthcare providers to give care to those who need it most. Our top priorities have been and will continue to be preventing the spread of disease and protecting the public health. We know that many South Carolinians are concerned about what impact this virus may have on themselves, their loved ones, and our state. The number of cases that ultimately occur will depend in part on all of our efforts to practice good personal hygiene, like hand washing, and protecting others by staying home when ill. We have been emphasizing cover your cough to protect others. But as a reminder, if you have a respiratory illness with a cough and fever, you should not be in public places, at large social gatherings, or visiting others, particularly those who are vulnerable to developing serious illness. Based on what we know so far, the CDC expects that many people in the United States will at some point in time, either this year or next, be exposed to this virus. This will include residents here in South Carolina. However, it's important to note that most people will likely not develop serious illness. While this is occurring as we expected it to, we still must continue to practice measures to help safeguard against illness, including practicing good hygiene. That means routinely washing your hands and covering your mouth when you cough. Individuals with signs of illness are asked to take seriously the recommendation to stay home from school and work and not attend public gatherings. From what we're seeing, this illness is very similar to the seasonal flu. So consider the measures that we take each year to help protect ourselves and those around us from flu outbreaks. Our public health professionals are continuing to monitor the status of the virus in South Carolina so that our state and its communities make informed decisions. As part of this measured approach, we are constantly monitoring our epidemiologic data and following CDC for evidence-based strategies to slow the spread of disease in our communities. As cases increase, we are prioritizing identifying close contacts who are at high risk of illness from exposure and who may be more likely to experience more serious illness. This includes our nursing homes and assisted living facilities, as well as other vulnerable populations with unique circumstances. We, like other states, are also beginning to practice social distancing for communities as a whole. We were able to quickly work with the Lexington Medical Center Extended Care Skilled Nursing Facility to identify and isolate contacts. In addition, the center had already taken proactive measures like limiting visitors. The facility has been completely cooperative as we work through our contact investigation, and staff are abiding by DHEC's and CDC's recommendations for helping to help protect this higher risk population. And this is an example of the importance of taking precautions to protect those at higher risk, like the elderly and people with serious underlying health conditions. We are continuing to work with communities to provide communications and education about illness, including alerting communities to be aware of potential spread. Again, each of us can do our part to protect those who are at risk of more severe disease, and it's all of our responsibilities to help prevent the spread of disease. We are still learning about this virus, and we're committed to keeping the public informed. As we learn more, we will continue to provide updates as quickly and as timely as possible. Thank you.
Thank you. Are there any questions?
Governor, in other states that the governor has ordered that bars and restaurants close as well, except for takeout.
All right, we've just been listening to Governor Henry McMaster and senior members of his administration in South Carolina. We want to go over some highlights of what we just heard. They have announced that all schools in the state of South Carolina will be closed effective immediately through the end of this month. Included in that, they have asked for waivers to allow them to feed students who require meals, who don't normally get a meal at home. They will receive 2 meals per day. They're in the process of working out whether those students will have to pick those up or whether those will be delivered to neighborhoods by buses. Speaking of buses, the state intends to equip buses with Wi-Fi so that students who live in areas that don't have access to Wi-Fi will be able to go to those buses as they plan to continue educating the students as they work out this plan for keeping them out of the schools until the end of the month. They also are canceling, or they're asking the U.S. Department of Education to allow the state to suspend all federal student standardized testing this year for all students in the state of South Carolina. They say it's too much of a burden for students and teachers to take on standardized testing at this time. Outside of the schools closing, they are asking that people condense their gatherings to 100 people or less in the state of South Carolina. Also, elections have been postponed until after May 1st in the state as well. So a lot of announcements today from the governor at that Emergency Operations Center in South Carolina. We also know that he's saying that they have plenty of testing kits for people to be tested if they are showing symptoms in the state. They also announced 9 new potentially positive cases today in the state of South Carolina. And if my math is right, with the 6 that we added yesterday, that brings the total number of cases back up to, I believe, 28 for the state of South Carolina, so less than 30 that we know of so far. So that's what we've heard now from the governor and his top officials with education and health in the state of South Carolina. We will, of course, bring you more on this tonight on News 3 at 6. If you are a South Carolina parent wondering now what do you do with your children, we would love to hear from you. Contact us on Facebook or Twitter. Or email us here at the station, news@wsav.com. We'll see you back here at 6 o'clock.